Welcome to today's presentation. Let's take a moment to explore this resource. If you're interested in nursing content, you can find a dedicated YouTube channel at. This channel offers a variety of videos tailored specifically for nursing professionals and students. It's a valuable tool for continuous learning and staying updated with the latest in the field. Connecting this to our overall theme, leveraging online resources like this can greatly enhance your knowledge and practical skills. So, I encourage you to check it out and see how it can support your learning journey. Welcome to this part of the presentation. The National Tuberculosis Program has been around since 1962, marking a long-standing effort to combat TB. However, during those early years, the treatment success rates were quite low, which was a significant challenge. To address this, in 1997, we introduced the revised National TB Control Program, or rntcp. This new approach was based on the Directly Observed Treatment Short Course, or DOTS strategy. Essentially, DOTS involves healthcare workers observing patients take their medication to ensure adherence and improve outcomes. This shift was a crucial step in strengthening our fight against TB and improving treatment success across the country. It laid the foundation for the more effective, structured TB control efforts we have today. Let's take a moment to go over some key abbreviations that you'll encounter throughout this presentation. First, we have NTI, which stands for the National Tuberculosis Institution. This is a central body responsible for coordinating TB control efforts at the national level. Next is NIRT, or the National Institution of Research in TB, focusing on research and development to improve our understanding and treatment of tuberculosis. Then there's NITRD, the National Institute of TB and Respiratory Disease, which plays a vital role in disease management and patient care. We also have JALMA, the Japanese Leprosy Mission for Asia, an important partner in regional health initiatives, especially in leprosy and TB control. Moving on, NTWG stands for the National Technical Working Group, a team that develops and oversees technical strategies for TB control programs. In terms of diagnostics, DSD is drug sensitivity testing, a crucial process for determining the most effective treatment regimens for resistant strains. Lastly, SDS refers to the state drugstore, where medications are stored and distributed at the state level to ensure timely access for patients. Understanding these abbreviations helps us grasp the various institutions and processes involved in our shared goal of tuberculosis control and eradication. Now, let's take a closer look at some of the key abbreviations and terms that are crucial for understanding our tuberculosis control efforts. First, we have the IRL, which stands for Intermediate Reference Laboratory. This is a vital facility responsible for more advanced diagnostic testing and quality assurance. Next is Dr. TB, or drug-resistant tuberculosis. This refers to TB strains that have developed resistance to standard treatments, and managing these cases requires specialized approaches. Then there's DMC, the Designated Microscopy Centers, which are the frontline facilities where initial screening and diagnosis happen through microscopy. Moving on, the STO, or State Tuberculosis Officer, plays a leadership role at the state level, overseeing TB control activities and ensuring program quality. The DEO, or Data Entry Operator, handles the vital task of maintaining accurate records and managing data flow, which is essential for monitoring progress and making informed decisions. We also have the SDS, or Senior Treatment Supervisor, who supports treatment adherence and monitors patient progress on the ground. Then there's the SDLS, or Senior Tuberculosis Laboratory Supervisor, responsible for overseeing lab operations and ensuring quality standards are maintained. Finally, EQA stands for External Quality Assurance, which is a systematic process to ensure that our testing and diagnostic procedures are accurate and reliable across all facilities. Understanding these roles and terms helps us see how each component fits into the broader TB control framework, ensuring that we work together efficiently to end TB. Now, let's take a closer look at some of the key diagnostic tools used in drug susceptibility testing. First, DSD, which stands for drug susceptibility testing, is essential for determining whether a Mycobacterium tuberculosis strain is resistant or susceptible to specific anti-tuberculosis drugs. This helps guide effective treatment plans. Next, we have cBNAAT, or cartridge-based nucleic acid amplification test. This is a rapid molecular test that detects TB bacteria and resistance to rifampicin, one of the key drugs. Its quick turnaround time makes it invaluable in early diagnosis and managing drug resistance. Then there's the NTF, or National Task Force, which is often involved in setting guidelines and coordinating efforts for TB diagnosis and control at a national level. Their work ensures standardized and effective approaches across regions. Finally, ICT, or immunochromatographic test, is another rapid diagnostic tool that usually detects specific TB antigens or resistance markers. It's simple to use and provides quick results, making it useful in various settings. Connecting this all to our overall theme, these tools and organizations play a crucial role in the fight against TB, especially in identifying resistant strains early and ensuring patients receive the right treatment promptly. This combination of rapid and reliable testing methods is vital in controlling the spread of resistant TB. Let's take a moment to look at our key objectives. First, our goal is to achieve at least an 85% cure rate for infectious cases of tuberculosis through the directly observed treatment, short course, or DOTS. This is crucial because ensuring effective treatment not only cures patients, but also helps prevent the spread of TB within the community. Second, we aim to increase our case-finding activities by improving the quality of sputum microscopy. The goal here is to detect at least 70% of the estimated TB cases. This means that by strengthening our diagnostic efforts, we'll be able to identify more cases early and start treatment sooner. Both of these objectives are interconnected and vital for our overall strategy to control and eventually eliminate tuberculosis. Achieving these will require a concerted effort, focusing on both treatment success and early case detection. Now, let's take a closer look at the 5 main components of the DOTS strategy. These components are the building blocks that enable us to effectively implement and sustain our initiatives. Each one plays a crucial role in aligning our efforts and ensuring we achieve our goals. As we go through each component, I want you to think about how they connect and reinforce each other, creating a comprehensive approach. Remember, the success of the DOTS strategy depends on understanding and integrating these key elements into our daily practices. So, let's explore them in detail and see how they fit into the bigger picture of our overall strategy. Let's take a closer look at the components of the 2006 Stop TB strategy. First, we emphasize pursuing quality DOTS, which means expanding and enhancing the directly observed treatment, short-course approach to ensure better treatment outcomes. Next, we address the critical challenges posed by TB-HIV co-infection and MDR-TB, recognizing that these are major hurdles in controlling the disease. We also focus on contributing to health systems strengthening overall, because a robust health system is essential for sustained TB control efforts. Engaging all care providers is another key point, whether they are public, private, or community-based, because a united front is vital for effectively reaching those affected. Empowering patients and communities plays a significant role too. When people are informed and involved, they are more likely to adhere to treatment and participate in prevention. Lastly, enabling and promoting research is fundamental. Ongoing research helps us develop better diagnostics, treatments, and strategies to eventually eliminate TB altogether. All these components come together to form a comprehensive and integrated approach, aligning with our overall goal of ending the TB epidemic through collaboration, innovation, and strong health systems. This slide doesn't contain enough information. That's why we're moving to the next slide. Let's take a closer look at the laboratory network. This is a crucial component because it connects various laboratories, allowing for efficient sharing of data and resources. By having a well-structured network, we can ensure that test results and other critical information are transmitted quickly and accurately. This connectivity not only improves the speed of diagnosis, but also enhances collaboration among different teams and facilities. Ultimately, a robust laboratory network supports the overall goal of providing timely and reliable healthcare services. Remember, in our broader context, a strong network underpins the entire system's effectiveness and resilience. Let's explore the key TB diagnostic methods endorsed by the rntcp. First, we have smear microscopy for acid-fast bacilli, which is a quick and cost-effective method to identify TB bacteria in sputum samples. It's often the first-line diagnostic tool used in many settings. Next is culture, considered the gold standard for TB diagnosis, because it allows us to grow and identify the bacteria more definitively, although it takes more time. Then, we have rapid diagnostic molecular tests, such as Gene Expert, which provide results within a couple of hours and can also detect drug resistance, making them highly valuable in timely diagnosis and treatment decisions. Radiography, or chest X-rays, plays a crucial role in assessing lung involvement and supporting clinical suspicion, especially when microbiological tests are inconclusive. Lastly, the tuberculin skin test is primarily used for detecting TB infection, especially in certain vulnerable populations, though it doesn't distinguish between active and latent TB. All these diagnostics form a comprehensive approach endorsed by the rntcp, ensuring we can accurately and efficiently identify TB cases to improve patient outcomes and control the spread of the disease. Now, let's talk about one of our new initiatives called NIKSHAY. This is a web-based IT system designed specifically for TB surveillance, and it was launched back in May 2012. The system is quite comprehensive and includes several key components. First, we have master management, which helps us keep track of all the essential data. Then, there are user details to ensure proper access and security. One of the core features is TB patient registration, where we record diagnosis details, provider information, HIV status, follow-up data, and treatment outcomes. Additionally, NIKSHAY captures detailed laboratory information, including solid and liquid culture results, drug susceptibility testing or DST, and cBNAAT details. For patients with drug-resistant TB, we also maintain specific data for Dr. TB patients. Overall, this system allows us to streamline data collection, improve monitoring, and enhance our response to TB challenges, aligning perfectly with our goal of strengthening TB control efforts through better surveillance and data management. Let's explore some of the key components that help streamline our health system. First, the referral and transfer of patients is a critical process. It ensures that patients receive the appropriate level of care by efficiently moving them between facilities when needed. Clear protocols and communication are essential here to avoid delays and ensure continuity of care. Next, the registration and notification of private health facilities play a vital role. By properly registering these facilities and keeping them informed, we create a more integrated network. This helps in tracking patient data and improves overall health service delivery. Moving on, SMS alerts to patients are a simple yet powerful tool. They keep patients informed about appointments, medication schedules, or health tips, which can significantly improve adherence and health outcomes. Similarly, SMS alerts to program officers ensure that those managing health initiatives stay updated on key activities or issues that may arise. Finally, automated periodic reports are invaluable for monitoring performance and making data-driven decisions. Automating these reports saves time, reduces errors, and keeps everyone aligned with the current status of health programs. All these elements together form a cohesive system that enhances communication, improves efficiency, and ultimately supports better patient care across the board. Let's talk about TB notification. It's crucial that all healthcare providers actively participate in this process. Every month, they need to notify each TB case they encounter to the district health officer or the chief medical officer of the district, as well as the municipal health officer. This consistent reporting helps us keep an accurate and up-to-date record of TB cases in the community. By doing so, we can monitor the disease trends more effectively and ensure timely interventions. Remember, this step is a key part of our overall strategy to control and eventually eliminate TB. Regular and thorough notification not only supports case management, but also strengthens the entire health system's response to TB. Now, moving on to the next points. First, regarding the ban on TB serology, it's important to understand that the currently available serological tests are not very reliable. They tend to have poor specificity, which means they can give false positives or negatives, leading to misdiagnosis. Because of this, these tests should not be used for diagnosing TB. It's a clear indication that we need more accurate diagnostic tools. Next, let's look at the direct benefits of our transfer schemes. We've established a robust linkage between TB patients reported in NIKSHAY and other systems like AADHAR and PEMS, which is the predictive emission monitoring systems. This integration helps us in several ways, such as ensuring better tracking of patient data, improving the accuracy of reporting, and facilitating targeted interventions. Connecting these points to our overall theme of strengthening TB control efforts, the key takeaway is that by improving diagnostic accuracy and leveraging technology for data integration, we can enhance our ability to detect, treat, and ultimately reduce TB cases more effectively. Let's talk about the initiation of treatment. When we're starting treatment, the first step is always to thoroughly assess the patient. This means understanding their medical history, current condition, and any specific needs they might have. It's crucial to tailor the treatment plan to each individual. Once we've done our assessment, we move on to selecting the appropriate intervention. This choice should be evidence-based and aligned with the patient's unique situation. It's not just about what works generally, but what works best for that specific person. After deciding on the treatment, the next key point is patient education. Ensuring the patient understands the treatment plan, its purpose, and what to expect helps improve adherence and outcomes. Clear communication here is essential. Finally, it's important to monitor the patient's response closely after initiating treatment. This allows us to make any necessary adjustments early on and helps ensure the best possible results. Overall, initiating treatment is a careful, personalized process that sets the foundation for success in the patient's care journey. This slide doesn't contain enough information. That's why we're moving to the next slide. Now, let's take a closer look at the fixed-dose combination for pediatric tuberculosis, specifically focusing on the daily dose regimen. This approach is designed to simplify treatment by combining multiple drugs into a single formulation, which can significantly improve adherence in children. The key point here is that using a fixed-dose combination helps ensure that children receive the correct proportion of each medication, reducing the risk of under- or overdosing. It also streamlines the treatment process, making it easier for caregivers to manage daily doses. Overall, this strategy aims to improve treatment outcomes by making the regimen more manageable and consistent, which is crucial in the fight against pediatric TB. Now, let's talk about the management of drug-resistant TB at the state level. The key here is the role of the state PMDT committee. This committee is responsible for developing a comprehensive plan of action. This plan should cover several critical areas, including implementation, expansion, and maintenance of our PMDT services. They also need to oversee supervision and monitoring, ensuring everything runs smoothly and effectively. Importantly, quality enhancement should be a continuous focus so that our services keep improving. Ultimately, the goal is to ensure that programmatic management of drug-resistant TB is well coordinated and effective. By having a strong state-level structure and clear responsibilities, we can better combat drug-resistant TB and improve patient outcomes across the board. Let's talk about the Drug-Resistant Tuberculosis Center. The plan is to establish district-level centers in key locations like medical colleges, district hospitals, TB hospitals, and also through collaborations with NGOs, private institutes, and corporate entities. These centers will play a crucial role in the management of uncomplicated drug-resistant TB cases. Essentially, they will be responsible for initiating treatment and providing ongoing care for patients with Dr. TB who don't have complicated cases. This approach aims to streamline treatment, improve outcomes, and ensure that patients receive specialized attention close to their communities. By setting up these centers across various institutions, we can create a more accessible, organized, and effective system to combat drug-resistant TB at the district level, which is a vital part of our overall TB control strategy. Now, let's talk about the Nodal Dr. TB Center. This is a specialized facility dedicated to managing patients who have additional resistance to second-line drugs or who cannot tolerate certain medications. These patients often require more complex treatment approaches, and that's where the Nodal Center comes in. It provides comprehensive care, especially for those who need palliative support, ensuring they receive the appropriate management and support during their treatment journey. This center is a crucial part of our overall TB control strategy, as it helps us address the most challenging cases effectively and ensures no patient is left behind. Now, let's talk about the NDRTB Center. This should be a specialized, tertiary care institute, meaning it's equipped to handle complex cases and provide comprehensive treatment. It's important that we have separate wards for male and female patients to ensure comfort and privacy. One of our key goals is to make all services available free of cost, so no patient faces financial barriers to receiving care. The center must also offer all the main specialties needed for effective treatment and management of TB cases. To ensure smooth operation and quality of care, a dedicated NDRTB committee will be formed, bringing together experts to oversee the center's functions. Additionally, we need to have a team of qualified doctors, nursing staff, and support personnel available around the clock. This comprehensive approach will help us deliver the best possible care and move closer to our overall goal of controlling and eventually eliminating TB. Let's start by talking about the ancillary drugs that need to be available. It's crucial to ensure that these supportive medications are on hand to manage any side effects or complications that may arise during treatment. Having these drugs readily accessible helps us maintain the continuity and effectiveness of the therapy. Next, we need to emphasize the importance of maintaining proper records and reports related to the programmatic management of drug-resistant tuberculosis, or PMDT. Accurate record-keeping allows us to monitor patient progress, ensure adherence, and evaluate the overall success of the program. It's a key component for accountability and continuous improvement. Finally, it's essential that we submit quarterly reports electronically. This regular reporting helps us stay on top of program performance, identify any issues early, and ensure transparency. By adhering to these reporting timelines, we contribute to a stronger, more coordinated effort in combating drug-resistant TB. All these points tie back to our overall goal: delivering effective treatment, maintaining quality standards, and improving patient outcomes through diligent monitoring and reporting. Now, let's talk about the importance of TB-HIV coordination. We've successfully implemented TB case finding in all HIV testing centers, which is a crucial step in early detection and treatment. When someone tests positive for HIV, they become eligible for free antiretroviral treatment, helping to improve their health outcomes significantly. Additionally, we're focusing on intensified case-finding activities, especially among HIV-infected pregnant women and children. These groups are particularly vulnerable, so monitoring and targeting these activities is essential to ensure no one falls through the cracks. Overall, strong coordination between TB and HIV services is key to controlling both diseases effectively and ensuring that those affected receive timely, comprehensive care. Today, I want to highlight some significant policy decisions that have been made to strengthen our TB control efforts. NACO and rntcp have officially adopted isoniazid prophylaxis therapy, or IPT, as a key strategy. This means that we're now implementing preventive treatment to protect vulnerable populations from developing active TB. It's a proactive step to reduce the burden of TB, especially among those with latent infections. Additionally, there's been a notable advancement with the introduction of rapid diagnostic tools. These tools have moved from being just a concept to practical, everyday use in our labs and clinics. They enable us to diagnose TB faster and more accurately, which is crucial for timely treatment initiation. Connecting these points, both policy shifts, adopting IPT and integrating rapid diagnostics, are aligned with our overall goal: to improve early detection and prevention of TB. They represent a move towards more effective, efficient, and patient-centered TB control strategies. Now, let's take a closer look at the National Strategic Plan for TB Elimination, covering the years 2017 to 2025. The plan has several key objectives that are crucial to our overall goal of ending TB. First, it emphasizes the importance of finding all cases of both drug-sensitive and drug-resistant TB. Detecting every case is the foundation for effective treatment and control. Next, once we identify these cases, we need to initiate the appropriate anti-TB treatment promptly. This ensures better outcomes for patients and helps prevent transmission. The plan also focuses heavily on preventing the emergence of TB in populations that are most susceptible, which is vital for stopping new infections before they start. Additionally, strengthening our institutions and human resources is a core component. This means building capacity, improving infrastructure, and ensuring that our healthcare workers are well-equipped and trained to carry out these strategies. All of these objectives work together towards the larger goal of TB elimination. They highlight a comprehensive approach: finding, treating, preventing, and strengthening. That's essential for making a real impact in our fight against TB. Now, let's take a closer look at some of the key strategies that can really make a difference in our fight against TB. First, engaging the private sector is crucial because a large number of cases are managed outside public health programs. We need their cooperation to ensure early detection and proper treatment. Active case finding is another important strategy. Rather than waiting for patients to come to us, we proactively identify cases, especially in high-risk communities. Managing drug-resistant TB cases is also vital, as these are more challenging to treat and require specialized approaches. Addressing social determinants, including nutrition, helps us tackle the root causes that make people more vulnerable to TB in the first place. Building a robust surveillance system allows us to monitor trends, detect outbreaks early, and evaluate our progress effectively. Lastly, community engagement and a multi-sectoral approach are essential because TB isn't just a health issue. It's connected to social, economic, and environmental factors. By working together across sectors and involving communities, we can create a comprehensive and sustainable response to TB. These strategies, when integrated, support our overall goal of reducing TB incidence and saving lives. Let's take a moment to look at the expected outcomes of these efforts. We're aiming for an 80% reduction in TB incidence, which means significantly fewer new cases emerging in the community. This is a huge step towards controlling the disease and preventing its spread. Alongside that, we're targeting a 90% reduction in TB mortality. Saving lives is at the heart of our mission, and these numbers reflect our commitment to providing effective treatment and early detection. Another critical point is ensuring that no patient faces catastrophic expenses due to TB. This is about safeguarding individuals and families from financial ruin caused by healthcare costs, making treatment accessible and equitable for everyone. Together, these outcomes highlight a comprehensive approach, reducing disease burden, saving lives, and protecting economic stability, aligning with our overall goal of ending TB as a public health threat. Now, let's take a closer look at the 4 strategic pillars that underpin our approach. These pillars are the foundation of our strategy and guide every decision we make. First, we have to understand that each of these pillars addresses a critical aspect of our overall vision. They work together to ensure we stay aligned and focused on our goals. Second, these pillars are not just theoretical concepts. They are actionable and measurable, meaning we can track our progress and make adjustments as needed. Third, each pillar supports the others, creating a balanced and holistic framework. Fourth, by focusing on these 4 areas, we can build a sustainable and scalable model that will drive long-term success. Ultimately, these pillars connect directly to our overarching theme of growth and innovation, helping us stay on course while adapting to new challenges and opportunities. This slide doesn't contain enough information. That's why we're moving to the next slide. This slide doesn't contain enough information. That's why we're moving to the next slide. Now, let's take a look at the key financial resources that support our efforts in combating TB. First, we have the World Bank, which provides crucial funding and technical assistance to strengthen health systems worldwide. Then, there's the Department for International Development, or DFID, which has been instrumental in funding programs focused on TB control and research. The World Health Organization, or WHO, also plays a vital role, not just in setting guidelines, but in mobilizing resources and coordinating global efforts. Another critical resource is the Global TB Drug Facility, which ensures the supply of quality-assured medicines to countries in need. The global funds to fight AIDS, tuberculosis, and malaria are also essential. They pool resources from multiple donors to provide financial support for prevention, treatment, and care programs across many countries. Additionally, the United States Agency for International Development, or USAID, contributes significantly by funding programs that improve diagnosis, treatment, and health infrastructure. Lastly, there's DANIDA, the Danish International Development Agency, which supports TB initiatives through funding and technical expertise. Together, these organizations create a robust financial foundation that enables us to implement effective TB control strategies worldwide. Connecting all of this back to our overall theme, their combined support underscores the importance of international collaboration and sustained investment in ending TB as a global health threat. This slide doesn't contain enough information. That's why we're moving to the next slide. This slide doesn't contain enough information. That's why we're moving to the next slide.